Thank you, Corda. Taoiseach, long COVID is a title given to a range of illnesses that have left previously healthy individuals who have not recovered from a COVID infection with no quality of life. These patients, once leading busy professional and family lives, are now in some instances bedridden, unable to eat and unable to communicate. Despite the severity of their condition, many are being denied medications and treatments that, while not curing their symptoms, could help to manage them and improve their daily lives. While health experts confidently advised that most people would recover over time, I have now published data based on a self-reporting national survey that I have commissioned over the last 18 months, which paints a very different picture. The incidence of long COVID symptoms has remained stubbornly constant over this period, at a rate of 6% of adults reporting that they are suffering from these post-pandemic symptoms. The poll data, commissioned from the Ireland Thinks polling company, highlights the continued prevalence of these debilitating effects 4 years after the initial pandemic. The data indicates that today over 61,000 adults are continuing to suffer from the symptoms associated with long COVID for more than 2 years. The most recent poll last month indicates that 27% of those with long COVID symptoms have had them for over 2 years, with a further 28% of adults struggling with these symptoms for more than a year. These figures clearly show that the HSE long COVID clinics are failing tens of thousands of patients right across this country. Many clinics remain understaffed and therefore are not fully operational. Instead of a centre of excellence approach, it has become a potluck, pick and mix of services with no apparent specialised training in understanding and treating patients. Despite all of this, there have been some very positive reports from patients about individual doctors and some multidisciplinary supports, including occupational therapy and psychology. Unfortunately, these are the exception rather than the rule. The interim model of care in operation in these clinics is now 32 months old and has had 0 updates. The HSE did commit to establishing clinical guidelines in line with HICWA recommendations last year in order to achieve some consistency for patients, yet these clinical guidelines have not materialised. Taoiseach, we need to ensure that long COVID patients are not forgotten and that they receive the care and support they need to manage their symptoms and improve the quality of their lives.
Thank you, Deputy. Taoiseach.
I want to thank the Deputy for raising this very important issue and also thank him for his long-term commitment to the issue. I think you've consistently raised the issue in the House on a number of occasions. And the Government continues to support the rollout of a national service for long COVID. In 2022, about 2.2 million was provided for implementation of the model of care. That trebled to 6.6 million in 2023, and now 8.8 million has been allocated for 2024. There are 6 long COVID clinics, 6 post-acute COVID clinics operating nationally. They are staffed by consultants in the areas of infectious disease, respiratory medicine, psychiatry, neurology, as well as allied health professionals, clinical psychologists. And you have St Vincent's, Beaumont, Tallaght Hospital, St James's Hospital, Cork University Hospital, Galway and Limerick University. The post-acute, those are for the long COVID clinics. And the post-acute COVID clinic operational under the model of care, you have the Mater Hospital, Tallaght University Hospital, St James's Hospital, Cork University, University Hospital Galway and Limerick University. The HSE is working with Letterkenny University Hospital to have a more definitive timeline around their anticipated launch date. And the HSE also advises there's a tertiary neurocognitive clinic in St James's Hospital led by a consultant neurologist with background in neurocognitive disorders. And that's accepting referrals from long COVID post-acute clinics around the country. What you've instanced there, spoke about a poll that I think you commissioned. And I haven't seen the details of the polling or the methodology around the polling. And is that an extrapolation that there's 60,000 from the poll? It didn't come, obviously, okay, yeah. No, I know. And there's the issue then of how do we develop effective therapeutic treatments for our options for patients suffering from long COVID. And the health services are still advising that that's very problematic, or poses a lot of challenges, because the pathophysiology, which is the physical and biological abnormalities of the body which occur because of a condition of a disease, is not clearly yet understood. And also no evidence-based treatment options exist at present for long COVID, resulting in the use of a symptom management approach, which mainly includes medical assessment, referral to the appropriate specialist. Now, the HECRA review, as you said, was commissioned, and the results were published in December of 2022. And I think monitoring of international data and research continues. But the HSE has engaged is undertaking an epidemiological survey, FADA, and that was launched on March of last year, with results due later this year. Now, that survey will perhaps provide an up-to-date, accurate insight into the prevalence of long COVID in the Irish population and risk factors for developing long COVID and inform service development. The HSE is engaging with GP representatives and patient groups, including Long COVID Ireland, a patient advocacy group on service development. And then in respect of children, the diagnosis and care is provided by GPs and existing referral pathways within paediatric services. And that again, the evolving evidence again has been monitored by the HSE in respect of long COVID in children. And so the challenges, it seems to me, are first of all to try and understand the impact of this disease.
We're way over time.
And utilise existing research more effectively and more quickly, perhaps, in terms of treatment options, but also more comprehensive service for patients with long COVID.
Deputy Naughten.
The poll results also raise another issue of concern. It indicates that those aged between 55 and 64 are twice as likely as any other age group to state they've been managing the symptoms of long COVID for more than 2 years. This needs to be investigated further, Taoiseach. And despite requests by patients involvement and feedback into the existing clinics, this hasn't happened, resulting in clinics failing to meet the needs of those with long COVID symptoms. And Taoiseach, this is clearly reflected in those poll numbers that I've published. Taoiseach, I'm calling on the Government to work in tandem with the HSE, with patients and frontline clinicians to expedite the delivery of a national action plan on long COVID, to include a revised model of care for patients, allocating funding to enable specialist clinics to become fully operational, and to recruit specialist clinicians across the health service.
Thank you, Deputy. At the outset, I think, I'm not sure whether you've shared the data and the methodology and so on with the HSE. I think it's important that that happens so that they can have a full assessment of it and would be helpful to them also, although they are doing their epidemiological survey, which will be comprehensive. But also the issue of, COVID itself was always a disease that affected older age groups much more than younger age groups. And that was a feature of COVID itself in terms of the impact of COVID on people. The older one was, the more challenging. Well, but long COVID, you're saying 55 to 64 are twice as likely to be still managing the symptoms after 2 years. And that's younger, relatively speaking, but it's probably in that category myself, so I better be careful what I say. But I think my sense is it's going to take a bit more to understand this, and I think we need perhaps, what I would like to see is, apart from a national action plan, is research, and more probably research commissioned by ourselves, and working on clinical trials and stuff like that around COVID. That's an important dimension that we should now be embarking upon, it seems to me.
Thank you.